Hello, everybody. Thank you for being here today. My name is Sophia. And to get started, I'd like to take a little poll. Who here has been present when a patient is receiving their diagnosis? I'm sure many of us have, and this is a very crucial time in the patient's life because they're receiving this information for the first time. Not only does it impact them, but it also impacts their family. Today, I will be telling a story about a time where I witnessed an impactful patient diagnosis. A little bit of background information on the patient. He was a male, fairly young, and in good health. His chief complaint was that he had a very hard time breathing, not only at nighttime, but throughout the day as well. He would not only have difficulty breathing on exertion, but while at rest. He stated that this all started right after a car accident. He also noted that during the car accident, he did hit his face. The airbag went off and it did smash in his face, breaking his nose. Knowing that his nose was broken, he did not seek treatment due to fear of reprimands from his workplace. Because of this, his nose did not heal properly and he was sent to an ENT specialist. The ENT specialist recommended that they do a fiber optic nail endoscopy. A fiber optic endoscopy for the nasal cavity is just what it sounds like. It was a small, thin fiber optic wire that the doctor was able to see within his nasal cavity. After this, he was diagnosed with a deviated septum. And of course, he was a little worried because he didn't understand those terms. But the doctor did explain that a deviated septum is just that when the cartilage within your nasal cavity, it's no longer straight, it's moved. So this movage or this curvage was causing an obstruction. Him and his wife were very concerned that he was never going to be able to breathe again. The doctor did give some options for treatment, and the best option at the time seemed to be a septoplasty, which is an invasive procedure that would go inside of his nasal cavity and physically shave off some of the cartilage and realign it so that his airway is straight, making it easier for air to go in and out. His wife was very nervous and she seemed very worried and had many questions. To alleviate her stress, the doctor explained all the pros and what little cons there were. The worst thing that could happen was that the operation would not work and that he would still have difficulty breathing, but there would be other therapies to help with that. So witnessing this diagnosis, I felt that they were scared and they did not know what to do. But with asking questions, the doctor was able to answer these questions and alleviate any worries that they had. When you are giving a patient their diagnosis, or if you're in the room when this is happening, it's always important to pay attention to the patient's body language, their gestures, their tone of voice, and try to ease any discomforts that you notice. Thank you for your time.